Welcome back to our city. I'm pleased to be joined on the second half of the show by Miss Daphne Duberville and Stanley Neron of our Office on Youth talking about National Public Health Week. Welcome to the show.
Thank you for having us.
Thank you.
Good to see you.
Good.
So before we begin, Stan, you've been on the show before.
Yes.
Stan's also a member of our Elizabeth Board of Education.
Yes, I am.
Yeah. Good luck with that, huh? How's that going?
Good. Everything's well.
I know. It's good to have you on there.
Thank you.
Daphne, have you been on before?
I have, but not on your show.
Oh, you've been
So
on with Alonzo when I was...
Probably with the Office of Youth. That was
Okay.
way back
Way
when
back
I was
when.
younger.
We did Youth View.
Yeah, Youth View.
Oh, when you did
She
youth
actually
View.
spearheaded that. Yeah.
Oh, you
Yeah.
were the one that spearheaded that program. That was pretty good.
Thank you. That was
We
a
did it
while
once a
back.
week and once a month in this time slot, right?
Yes, exactly.
It's good.
Yeah.
See,
That
it's
kind of
fun.
went away, though?
Yeah, we kept it going, and then we had schedule conflicts.
Right.
So it was,
So, Daphne, tell us a little bit about yourself.
Well, my name is Daphne. I work for, of course, the City of Elizabeth, but I do Elizabeth Municipal Alliance Committee, which is focused on drug and alcohol, and I also do rental assistance. But right now, I'm just getting my master's in public health at Rutgers University School of Planning and Policy / the School of Public Health.
So what's your undergraduate degree in?
Public health as well, and women and gender studies. And I
Is that
graduated
from Rutgers?
Rutgers, New Brunswick.
Yeah.
So it's been an interesting ride to just see that I finally getting to put the degree to use.
Good for you.
Paying Sally Bay for a reason.
That doesn't happen to everybody, by the way.
No, it doesn't. It's definitely a blessing.
My degree's in
Definitely
economics, and
is. You're using it. It happens. It
well, my
happens.
master's degree is in public administration, so at least I'm using that. that's for
Exactly.
sure. This is National Public Health Week. So, Daphne, tell us about it.
So National Public Health Week is an initiative that was created by the American Public Health Association. And the primary reason for Public Health Week is to kind of basically highlight what is public health and also to bring attention to some health issues that we're having in our community, whether it's obesity, whether it's, of course, clean air. Like you just recently passed the Clean Air Act for the City of Elizabeth and public spaces. And so that's kind of what National Public Health Week, it gives towns the opportunity.
Do you think that was a good thing?
I do think it was a good thing. I think the second phase of it would be definitely imperative to kind of give people help to, if you want to stop quitting, where do you go to get resources to stop quitting and just to get more information. But I definitely think it was a big, important initiative for two reasons. Number one, smoking doesn't just impact the smoker, it impacts everyone. And secondly, it's model behavior. What are we teaching our kids in regards to smoking? So I think the city taking the initiative forward on that is definitely setting a great image and a great...
Do you smoke?
No, I don't smoke.
Do you smoke?
No.
Oh, good.
Never have.
Yeah, good.
No. Good to dare.
That's right. You remember that from DARE?
Yes, actually.
Do you really?
My dear
Tell us
officer
about
was,
that.
Officer Dimid was my dear officer. He retired, I believe.
He did. Mike
Yeah.
Dimid.
Yeah, Mike Dimid. And the reason why I remember his name is because his name is spelled backwards the same. Still spells Dimid. So, yeah.
That's right.
So things that you remember from 5th grade. So definitely, I've always been a push for smoking because, again, it doesn't just impact the smoker. Secondhand smoking impacts everyone, children, adults. So it's one of those things that, it's not just like drinking, it's just you're impacting
So you're an
yourself.
Elizabeth girl. You went to school here and everything, right?
Correct.
Grew up here.
Yes, from pre-K straight to high school.
Yeah. Okay.
I've been in Elizabeth.
So Stanley, and as a member of the Board of Education, the First Lady has come out with plans to encourage schools to have healthy eating.
Yes.
Do you discuss it over there at all? Or?
Yes, we do. It's one of the big initiatives for the Board of Education to make sure that healthy eating is a part of our school and our food services. And that's something that we're pushing forward and that we're making sure is happening in all the schools.
So is there a theme this year, Daphne?
Well, there's not necessarily a theme for Public Health Week, but there's a theme in public health, and it's basically save money, save lives. You said you got your degree in economics. As you know, cost-benefit analysis is one of the big things. Especially,
now you're being my teacher.
yes.
Oh, you really bring things back here, my friend.
Especially when it comes to public health, we're definitely about saving money because when people realize how much cost is saved, when people change their behaviors and they, of course, encouraging walking, how much does that save in terms of heart diseases and heart medications? When we talk about smoking, how much does that save for somebody that can, down the line get cancer? So that's really what public health is about. It's definitely about cost analysis and also saving lives and saving money. So it's kind of like you're paying into your health.
So what are we doing? What are we doing in the Department of Health this week?
We're doing a lot.
We're doing a whole lot, from screenings to healthy cooking, nutrition, You know,
We had a walk last week.
yeah, we had started a walk last week, and basically
How'd that go?
It went well. You know, went well with the staff.
Was it raining? Did we go outside? I wasn't here. Did we walk around inside?
So we had a team of people who walked outside, who wanted to walk outside, and then we had others who walked around the building.
Oh, we did.
And did we did a few laps. You know, so it was good.
Which one did you do?
I was indoors.
You were indoors.
Yeah.
Did you go out?
I think I was studying at the midterms.
Oh, you were studying the
Yeah.
midterms. Okay. So what else are we doing besides the walk? I'm sorry.
We're doing the healthy cooking and nutrition courses with our families and youth.
Do you cook?
I do.
Yeah.
I
Do
do.
you?
I'm
No.
Do
a
you?
graduate student.
No, I don't.
You don't cook?
Unless it's on the grill in the backyard. No.
That's cooking.
That's cooking.
cooking.
That's actually
Yeah.
healthier, to be honest.
I know, but other than that, that's it.
You know, and I'm actually very excited about our nutrition courses that we're going to be doing, because it's really plant-based and kind of steering a lot of people to go vegetarian and understand the benefits of being a vegetarian, because I'm a pescatarian myself, so vegetarian who still eats fish.
Pescatarian is a fish guy, right?
Yeah.
I could figure. But no chicken?
No chicken.
No.
No chicken.
Just fish.
Just fish.
Huh. I got to tell you, man, I don't know what I would do without a steak once in a while.
I can't.
So-
I can't leave chicken, so I don't know.
You can't eat chicken, but do you eat steak?
No, I don't.
Beef?
No, I'm
You
not
wouldn't eat
really-
red meat?
No, because I don't eat fish, so it'd be hard for me to be a pescatarian.
Yeah, so you have to eat something, so you eat
Exactly.
chicken. Okay.
Yeah.
Interesting. Besides cooking, what else?
And then we have a health fest, which is happening on Saturday, on the 12th. You know, where we're going to be doing. We have a number of vendors coming out that's going to be discussing public health and different health vendors. Healthy activity. We're encouraging for youth to be engaged in physical fitness and healthy activity. And you know, the department has also adopted HEPA standards. You know, which is healthy eating and public. Physical activity practices for our youth in our after-school and programs, and also reducing the amount of time they spend playing with their iPhones and technology. We really want to encourage them to get involved and do something physical and understand the importance of healthy eating. So providing more healthier snacks even in our after-school programs and the programs that we provide throughout the city.
So in March, we celebrated Colon Cancer Awareness Month, and we encouraged our residents to get checked. Now, I know how important this is. As a matter of fact, I'm even still wearing the blue ribbon that says "Get Checked," which is something that was given to me by my doctor, actually. So how important is this and what we do in the city of Elizabeth?
Well, it's extremely important. You know, catching it at an early stage or being screened, you know, as Daphne stated earlier, is definitely cost effective to the individual. But it's also, it helps you health-wise, because if you catch your cancer in an early stage, you can take preventive measures. And it's also very important that we educate our residents and our youth at an early age, so that they understand the things they need to do, as far as from healthy eating to physical fitness to different practices that they can apply in their lives to prevent things like cancer from happening. And
How do you encourage young people, though, Daphne? Exams like this are important. I mean, because if you're young like you guys, you feel that you're invincible, right?
Yeah. I think with screenings are considered primary prevention, and the reason why in the public health field we're definitely promoting that, because it impacts everyone. If you think about it, if you catch something early, not only are you helping yourself, not only are you helping in cost, but also the toll it takes on family members. We often forget about the family members of those who have cancer, who have those diseases. So primary prevention is kind of one of the ways to make sure that you're looking out for everyone and just not yourself. And how we encourage youth is it can happen to you. I mean, if you think about now, there's a new trend of youth getting heart attacks. Like anything can happen, especially with dietary habits of adolescents my age and not getting enough physical activity, constantly being on the internet. So age doesn't even mean anything. You can find an 80-year-old that's healthier than a 19-year-old. So that's definitely.
So what are we
one
doing on
message.
April 12th?
it's our health fest, you know, taking place at the our soccer field in the First Ward. And you know, we'll have vendors there, we'll have games, we'll have awareness materials from different vendors that'll be there. We'll also have healthy foods and snacks available for the residents.
You cooking?
No.
No,
It's going to be at the Miller Evans Logan Community Center, and our main focus is two things that we're doing there is the NJ Seed, which is kind of like a free program for those who are below 250% below the federal poverty guidelines. They're going to get free screenings for prostate cancer, mammography referrals. And the reason why it's important for us to push this NJ Seed is because we don't want cost to be a barrier for people to seek health. And we're definitely going to have a lot of our sponsors there. One of the main things I have to highlight, because I do drugs and alcohol, is we're doing a screening of...
You do drugs and alcohol.
No, prevention.
Prevention.
No, drugs and alcohol prevention.
Just want to make sure you clarify that.
We're partnering with Prevention Links, and we're also partnering with Proceed, but primarily NCADD, and we're doing a screening of Anonymous People, which is a documentary about recovery. And the very big push that we're trying to push is prevention, treatment, and recovery when it comes to substance abuse, because it's definitely one of those underlying epidemics that's going on throughout our communities and our county as well.
I want to thank, go ahead.
And we're also doing HIV and AIDS education that we'll be conducting at the Peterstown Recreation Center in Peterstown.
I want to thank the both of you for taking the time to join us on the show this evening. I appreciate your work on National Public Health Week and everything that you do for the young people of our city, too.
Thank you.
Thank you.
Thank you for having me.
For Stanley Neron and Daphne Duberville and Valerie Allen on the first segment of our show, I'm Chris Polwage, and we'll see you next week on another edition of Our City.